Doctors, they are working to unravel another mystery surrounding COVID-19, these so-called long haulers. These are patients who are experiencing symptoms months after diagnosis. Let's talk to Dr. David Putrino. He's been working with this long-term patient wing, if you will, as Director of Rehabilitation Innovation at the Mount Sinai Health System, and he joins us live. Doctor, thanks for being with us.
Thanks for having me.
All right, first of all, let's talk about these symptoms. When did you realize that these long-term effects might be something that could stick around for a while?
Yeah, so we actually started to catch on to this in around May of 2020. My role at Mount Sinai in rehab innovation is to rapidly develop things that can help patients quickly. So when the acute surge was actually hitting New York City, we developed a remote patient monitoring app that allowed us to track patients and their wellness over time and really escalate things if they were getting unwell at home. And we were tracking thousands of New Yorkers, and we started to notice a small percentage of these people were not getting better, but they were developing a new set of symptoms. And that was when we really started to ring the alarm bells that there was a persistent syndrome that was carrying on in people with less severe cases of COVID.
All right, so let's go through these symptoms. I think a lot of us have already heard about the loss of taste, this loss of smell, but talk to us about what the symptoms in specific that you look for.
Yeah, you've listed a couple of them up there, but the more persistent symptoms, number one is definitely fatigue. We also have exercise intolerance. And when I talk about exercise intolerance, I mean we have people who were previously running 5Ks and marathons, and now all of a sudden, if they walk up the stairs, they're knocked out for 2 days. In addition to that, many people are complaining of shortness of breath, chest pain, heart arrhythmias and high heart rate. And then we're also tracking around 50 or so other persistent symptoms. In addition to this, people are also consistently reporting cognitive difficulties, difficulty concentrating, brain fog, short-term memory loss. It's a very
Let me ask you about
debilitating
these in specific, because I want to dive a little bit deeper into them. Let's talk about the brain fog, right? Because a lot of us kind of feel like we're in a brain fog because we've been quarantining, we've been isolated and whatnot. How do you know the difference between that and this true brain fog that's associated with COVID? Because some folks may have gotten COVID-19 and aren't sure if that's long-term or not.
Absolutely. I think you raise a really good point. I think there was a great piece in The Atlantic actually last week talking about the fact that we all have a little brain fog right now from our quarantine experience. The difference between this in the long haulers is the fact that the brain fog is typically linked to attacks of other symptoms. So as their other symptoms start to build up, they'll also start to experience these cognitive symptoms that are linked in with the other symptoms, and so they get more severe as the other symptoms get more severe.
Gotcha. Okay, what about the loss of smell and taste? Because I have read that in some cases you can retrain your body to maybe get it back. For example, if you start smelling certain oils and certain things, it'll try to trigger it to come back.
Yeah, the loss of sense of smell is one of these things that is still a bit of a mystery to us. But you're exactly correct. A graded sensory reintegration program is currently the best method we have for returning sense of smell. In addition, we're also running clinical trials into different supplements that may help to alleviate the inflammation that may have caused the loss of sense of smell. But it is one that I think we need to be prepared for the fact that it will take a very long time to return in cases where you had complete loss of sense of taste and smell.
Well, and that can be dangerous, right? Because sometimes you need to smell smoke. You need to smell other things within life to know that you're heading in the wrong direction, or danger could be something that you're heading towards. So that's important. Hopefully you guys can get a handle on that. I want to move to something else though, because most of these patients from a particular population, is that true? Is it more women than men? Give us an idea of who's getting these long-term effects.
Right now, the pattern that is emerging in New York, and I say New York because I think it's really important that we acknowledge the fact that in healthcare, when we're learning about a new condition, many historically excluded groups will not immediately be acknowledged as having similar conditions as non-historically excluded groups. So currently in New York, what we are seeing is slightly more women than men are
Really?
reporting these
Okay.
symptoms, and a median age of around 40.
Okay, gotcha. Very quickly, for folks listening to this and want help, they realize, hey, I'm a long hauler, where can they go?
Absolutely. If they're in New York City, they should reach out to the Center for Post-COVID Care here at Mount Sinai in New York City. And centers for post-COVID care are popping up all over the country. So typically they can reach out in their locale and find a center for post-COVID care that we're trying to organize all around the country to
Yeah,
create a unified response.
that is fantastic. Dr. Putrino, very good information today. Thanks so much for the work that you're doing.
Thank you very much for having me.